Can hear me? I believe we can all hear me loud and clear.
Yes, sir, we can hear you. Good afternoon, sir.
Yeah, good afternoon. Okay, like Mr. Olusoji Ajao said, my name is Mohammed Olatunji Bello, and I based here in Maiduguri, Borno State. So I'm just here to facilitate um, introduction to and understanding gender-based violence. So I believe some of us already had uh, one what do you call it contact or understanding about what gender-based violence is all about. But we want to get more because as we are as a nation, there are a lot of things probably going on within our community, our homes, our society that we need to actually protect the right of a woman and then see how to take care of issues that has to really uh, violence against women. So, with my slides, we'll say some of these things. We want to just look at the overview of what do you call it, what GBV is all about. You can see from the first presentation, we talked about the impact of. Can you hear me? Hello, hello.
Yes, we can hear you.
Okay,
Yes,
okay.
we
I
can
just want
hear
to know
you.
that. Okay, okay. So, from my slide, you can see the overview of what around the world. A lot of cases of GBV have gone around and has its own impact on women and girls, and even men and boys are involved because we always have the belief that GBV is all about women alone and girls, but there are some aspects of GBV that has to do with what do you call it, with men and boys also. So, and we know, like they said now, when you have people talk about gender-based violence, they interchangeably use it with violence against women, intimate partner violence, and things like that. So those are different terminologies. To be precise, intimate partner violence has to do with probably your boyfriend or your husband and things like that. And the GBV is the general terms for all violence against women and girls. So we have that, and all these things happens around the world. It's not just basically around Nigeria or our community alone. So there are a lot of form of GBV that we know. So, and what do you call it, we have for this, we have a lot of definitions that has to do with
With
gender-based
gender
violence.
violence.
So
So
let's go to my
let's
next
go to
slide.
my next slide.
Mhm. So we want to look at the objectives of this training. So first of all, we need to understand and describe the difference between sex and gender. Hello?
Your slide is not changing. It's still on
My,
slide one. Your
oh,
slide is
it's
not
not
changing.
changing. Are
It's
you
on
sure?
slide one here.
Eh.
Yeah, it's on slide one here. We are just seeing
Okay.
slide
Let me.
one.
Let me. I will check. Is it? Has it changed now?
Yes, yes. Can you put it on presentation mode so that it's
It's on
bolder?
presentation mode, so that's why, yeah, it was on presentation mode before, and you said it's not changing. That was why I have to bring it back to this one.
Okay,
It
no
was on
problem. You can
present.
go ahead. You can go ahead. You
Eh?
can go ahead like this. We can
Can you
see
all see the
humanitarian
slide?
overview. Yeah, it's fine. It's changing now. You can go
It's
ahead. Don't
changing.
worry. Go ahead.
Let me say, is it changing now? Is it changing now? SOG.
It's fine. It's fine now. We can see it now. Your slide is
Okay.
changing.
Okay. Where are you? Are you on introduction now? Can you see the introduction to gender-based violence?
No, we are seeing humanitarian overview.
Okay. Let me just go back. I don't know why this thing is not changing. Okay, let me go to the second one. Can you see now humanitarian overview, Abby? What
Yeah,
about
yeah,
here?
yeah,
Uh-huh.
yeah. Closer to GBV, yes. Go ahead. Closer to GBV, you can see. Yeah, go ahead.
Okay.
Let me. All right.
Okay. You are on introduction to GBV, right?
Yes, go ahead.
Eh,
Sorry to
okay.
interrupt you. I'm sorry to interrupt you.
Okay.
Go ahead.
Okay. So we talked about the objectives of this training. That is understanding and describing the difference between sex and gender. Then understanding and describing the relationship between gender-based violence, power, use of force, and consent. Then we have to define some of the terms, different form of GBV and sexual violence that we have. So can like we said, we have sex and gender, and people interchangeably use this. We need to know the difference. What is sex? What is gender? So can you see my screen, SOJ? Hello, hello.
Yes, I
We,
can see your
we can see
screen.
your screen,
We
sir.
can see
Okay,
your
what can you see on my screen now?
introduction to gender-based violence.
I've moved away from that place, so that's what I'm telling you now. Can you see it now? Key terms.
Yes, key terms. Key
Okay.
terms.
No, okay. So let me just use this one instead of it's like the thing is not aligned with the slideshow, so that's why it's not moving. So the key terms, we have the sex. So we all know about what sex is generally. It's being referred to the physical biological difference between male and female. It's been determined by biology and does not change over time. So without surgical intervention, what would mean about, at least we have some people that are here that are, what do you call it? They are medical worker, health practitioners that understand what they mean by surgical intervention. Like probably you want to do what do you call it? Plastic surgery, probably to change male to female or female to male. We have an example of one of these Elon Musk, a child that changed from male to becoming a female. So, and we have a lot of examples like that around the world that they change their sex to one male, maybe and to female, and female to male, like that. And some wants to become neutral. So, those terms are very, very important when we are discussing GBV. We need to really understand, okay, the what is being referred to as a physical, the biological difference between male and female. Okay, what makes male to be different from female? The male has what do you call it? Their the penis, and then the female has the vagina and the breast, which you can see physically. So those are one of the differences. And then the female has a womb where they can conceive a child, while male cannot conceive. There is no uterus at all in the male. So those ones you cannot see. You cannot. You can actually differentiate that. Even let's say male, the male sex men that they have, no matter how they do, they cannot conceive. They cannot carry pregnancy. It's only female that has the egg, the ovaries, that is being released as a true menstrual period every month, every 28 days, that are shed, and then that they can actually, okay, when there is a conception between male and female, there is a sexual intercourse that can be resulting into pregnancy, because the female has what do you call it? They have a womb that is allowed naturally or biologically, as described from birth, that okay, they can carry pregnancy, but male cannot do that. So it takes a lot of things for you, a lot of surgical expertise for you to even okay, you want to carry a female womb into a male, structurally or biologically has been that there is no way, because the male has a testes, and with the penis that they have, while female does not have that one. So those are part of the physical differences that actually differentiate male and female, that we talked about, determined by biological constructs of human being. And then and we know that male and female does not change, except probably you do a surgery, like I just mentioned there. Then gender is a different thing entirely. Now we were talking about gender. This we can say that is referred to an attribute or rules um, differentially ascribed to male and female. So it refers widely as shared ideas and expectations concerning men and women, which determined by social factor, history, culture, tradition, society, norms, and religion. So gender role can be different and it can change over time. So that's one of the difference between what do you call it. So as we go further, we'll also expatiate and see what we were discussing about on this. Then another terms that we want to consider here is power. One of the key terminologies in gender-based violence is power imbalances. So, and how do we define power? We said is the capacity or ability to direct or influence behavior over others or the course of events. That is, you must have like let's say in an organizations you have the director, or the let me say the head of the family. Head of the family, we have a father as the one that has the absolute power within the family. Whatever he say is the final word that most people will consider. So we'll use that one as a part of the at least in the family. The power between the husband and wife, I structurally believe the husband has more power than the wife. We are not talking about physical power, but we are talking about authority here. People that give the final orders and then people respect and do like that. So that is what we are talking about. So because when we are talking about power, people will not think about physical strength. No, that is not what we are referring to here. So then we also have the violence, the use of physical force intended to hurt, damage, or kill someone or something. That is an example of violence that we can, one of the definition of or terms of violence that we can use. That is, you then we have the survivor, a persons who remain alive after an event in which might have caused death or an harm to that individual or disability. It could cause a disability in terms of, let's use the example of rape or something, like it can cause an injury to a person. So a survivor could be an individual that is probably been sexually abused or harassed, and at the end of the day, the person has a the person has a life long disability that will actually like be a survivor. Could be like somebody, let's say a 14 years old girl, or a case of early marriage, um, a girl of 10 or 14, 15, that their female organ is still developing and got into a marriage, and then there's a sexual intercourse between the husband and wife, and along the line, the during penetrations, the female genital has damaged. Along the line, you see the woman coming up with obstructed or fistula. So it could be a rectal vaginal fistula, it could be anal, what do you call it? What do you call it? Any of the fistula that happens in the women. And when this fistula comes, or it comes with a lot of um, challenges like rejection from the family, from the community and all that, because it comes with when a woman can no longer control his bladder or anal sphincter, and then they urinate or pass excreta without control. At the end of the day, they they become smelling, and then nobody want to take them in the place of work. The husband reject her, the community reject her, they are being isolated in the community. So that's a kind of survivor of physical or sexual harassment, or forced marriage. It could be through rape, it could be early marriage, and it could be a lot of things that actually so that we are trying to give example of a survivor here. So we said somebody that remain alive or active even after something that might actually cause an injury to them. So perpetrator is a person who carry out the harmful or illegal act or immoral act. So then we have what they call the word coercion. So that is the persuading someone to do something by use of force or threat. So this could be like example of probably somebody maybe let's still use the case of maybe in an IDP camps you have people that give food, that give what do you call it, the a community that maybe you are giving food to, the you are the one that in charge of food and things like that, and people want to have access to food. So for you to have access to that food, they will tell you that before you can get the card for food, you must have a form of sexual intercourse or something like that and things like that. So with that one, that's a form of coercion or force, and then you can be a physical coercion, or it could be a threat, probably use of weapons to threaten somebody, like a knife, guns, or any other things. So that's also we can use that one as example of coercion. And consent means permission for something to happen or agreement to do something between two. At least we give a permission. We all know, understand informed consent. We have consent and informed consent. General consent means permission to happen or agreement to do something. So when it's an informed consent, is probably you have you want to get information from somebody, or you want to get somebody to do something for you. You have to tell them about the harms that can actually befall them when they are doing that things. Then they are already aware. Okay, if I'm doing this, and these are things that, and then they agree to go along with it. That's an informed consent. But this is general consent, is you give an agreement to do something even without what do you call it, any prior information. So then the next on our slide is definition of gender-based violence. So there are a lot of definition of gender-based violence around, but here we'll try to be as simple as possible so people will understand. So, like here, we have GBV as an umbrella terms for an harmful act that is perpetrated against a person will, that is based on socially ascribed gender, that is difference between male and female. Then it could include the act that inflict physical, sexual, or mental harms or suffering or threat of such action as coercion or other deprivation of liberty. So the definition here we see is as simple and straightforward. It's just an harmful act that is being perpetrated against a person that will, that is based on socially ascribed gender difference between male and female. So, and they said it could be a physical, sexual, it could be mental, or it could be in form of economic deprivation. As we are going along, we seem to understand part of this thing. So, let's move to the next slide. Um, then we have the types and forms of GBV. So, the physical types, we have the physical abuse, sexual abuse, emotional abuse, economic abuse. So those are types of arms, and then we have harmful traditional practices. So I've mentioned five now: physical, sexual, emotional, economic abuse, and harmful traditional practices. So looking at physical abuse, we said hitting, any form of hitting, slapping of somebody, shoving of somebody, or grabbing, or pinching, or biting, hair pulling, or burning, or strangulation are common form of physical abuse. This type of abuse also includes forced pregnancy, forced abortion, knowingly transmitting STI to an individual, and denial of medical care. They are all form of physical abuse under forms of and types of GBV. Then we have the sexual abuse, which is coercion or attempting to force a sexual act, contact, or behavior without consent. We understand when we said having a sexual contact without consent. It could even be between husband and wife. So that's where the intimate partner comes in place, violence. So there must be consent between two individuals agreed. Okay, we want to do it, two consenting adults. Okay, we want to do this. Is not between a adult and a minor. We have the minor, we have the adult. People that are under Nigerian law, we know that a minor is below the age of 18, and an adult is anybody 18 and above. So, so we are now saying that okay, sexual abuse could be coercion or an attempt to coerce any sexual contact or behavior without consent. Sexual abuse includes, but not limited to, marital rape, attacks on sexual partners of the body, forcing sex after physical violence has occurred, threatening, treating a woman in a sexually demeaning manner. So we have some of these things: treating a woman in a sexually demeaning manner. So then we go from here to the next point here: emotional abuse. This could be an undermining self-worth or self-esteem. This may include, but not limited to, constant criticisms, diminishing one ability, name calling, or damaging a woman's relationship with her children. So this is another form of what do you call it, GBV that could happen an individual. Then we have economic abuse, that is denials of resources. When we talk about economic abuse, we are talking about denial of resources. You deny somebody ability to make money and take care of his immediate needs, so that you make them dependent on you, making an attempt to make a woman financially dependent by maintaining total control over financial resources, not allowing them to work, not giving them resources to be able to hold a place of authority and things like that, withholding her access to money or forbidding her to attend school. That is denial of school. Girls are being denied schools in some areas, or employment when positions are for. That is why you see some places they will say that women are encouraged to apply, because there are places whereby you know that position is there and the women will not want to take the job. They may say that they will not take them, or probably because of the number of women available attending what do you call it, already like we know that the gender imbalances that we have and the power that they will not want to take women in. So organizations seek to say that, okay, specifically terms that women are given high ahead of other to employ, so that the issue of this economic abuse can be reduced. But we know that most times what we have is people denying people resources, and it comes from mutually from a family whereby some people, you see some men will not probably are not allowing their wife to work, and then being dependent on them, and they have total control of their financial resources, and at the end of the day, whatever they say, they must abide by it. They cannot form an opinion of themselves, and then probably deny girls child education and even the boys child from attending school. So all those are a form of economic abuse and a form of gender-based violence. Then we have the psychological abuse, which that is the element we are talking about. This psychological abuse includes, but not limited to, causing fear by intimidation, threatening physical harm to self, a woman, or our children, or our family or friends. So destruction of pet and property, then forcing isolation from our family, friends, schools, and other work. So that's a form of a psychological or mental abuse. So then we have the harmful traditional practices. These practices are rooted in cultural and religious norms, although they are treated as varied or as the culture. They occur. A common contributor of these practices that is that they are related to women sexually and are often enforced as a way of keeping women in subordinate role. Example of that, we have the female genital mutilations, FGM. I know many of you have heard about it, where the female genital is being cut so that they will say that they don't want them to be promiscuous and things like that and things like that. So that's a then scarification of probably face and some other things like that is also a form of harmful traditional practices. There are a lot of things that comes with this thing that actually has effect psychologically and makes women to be emotionally or abused, and also make them to be less of a woman. So that is why one of the reasons why all these things are being discouraged within our society, and there are campaigns to go against culture that does this, because they also have their own impact on the health of the woman. Some of them cause low sexual libido. Some of them can cause um, and other what do you call it, sexual problems that can affect women, even in giving birth and other things like that. So there are a lot of things that comes with these harmful traditional practices. So that is one of the reasons why we need to discourage them within our society. So among the most known traditional practice that we talked about, you said, is FGM. Then early forced marriage. So forcing a girl child to marry at a tender age is one of those things. Not allowing this one deprive them of having education. Once a child at 10 or 12 has already forced marriage, so that is the period that they are supposed to be in school. So, and that period, and they're already out of school, and they are not allowed to go to school with their age mates. They are already producing children instead of being in class. So, it's also a form of traditional. And then we have culture that have honor killings of women and other things, and then dowry abuse, widow ceremony, and denial of education. So, all these things are harmful traditional practices that must be and a form of gender-based violence. So then that is that on understanding types of gender-based violence. So now we have the understanding the consequence of GBV. So, and this one we have objectives that we also go align with it. That is identifying the consequence of gender-based violence and coping mechanisms, understanding the impacts on the individual, the family, and the community. Then understanding the importance of coping mechanism factors that promote recovery and learn what an individual, the community, healthcare provider can do to help with survival. So so let's go to the business. So the consequence and of violence can be immediate, and we know, like we all know, that it could be immediate. When we talked about immediate or acute, it could be like maybe a death, or maybe destructions or harm to the female genital part, or it could be that one. When, let's say, a good example of rape, where a minor is being raped and their female organ has been damaged through the act, and then probably introduction of sexual transmitted disease or HIV. So those are part of the what do you call it, that can actually cause and it can lead to death. Bleeding can occur. A lot of things can occur. And then it could be long lasting, or it could be chronic or fatal. So research constantly find that that the more severe the abuse, the greater impact on a woman, the physical and mental health it is. So, and these are the part of things that once this kind of thing abuse occur, it has a last longing effect on the survivor if a lot of things are not put in place, like one having PTSD, post traumatic stress disorder, as a result of the abuse that they have suffered. And then probably when somebody that's involved this kind of, they may not be able to stay alone in a locations with a man. They may not be able to do a lot of things that will come around that their impact, especially when it's done to a child and then even an adult. So it comes with a lot of psychological or mental impact and PTSD. So in addition, the negative health consequence can persist long after abuse has stopped. That's what we talked about, PTSD, consequence of having a recurring effect over time. The consequence of violence tend to be more severe when women experience more than one type of violence, e.g., multiple incidents over time. When the incident occur like twice repeatedly, maybe a husband is physically abusing and beating the wife constantly, so it's also a form of so it become so then the physical consequences. Now we have acute or immediate physical injury such as bruises. When physical abuse being meted on an individual, a woman, you can see the signs of bruises, burns on the faces, bites, as well as fractured or broken bone or teeth. So you can see serious injury that can lead to disability, including injury to the head, to the eye, to the ear, to the chest and abdomen. A lot of things can happen. Then we have the gastrointestinal conditions such as what do you call it, chronic pain syndromes and other things like that. And then death can also occur as a because of physical consequence of abuse, and age-related death also can happen when the person is being transmitted and a PEP is not being administered within the first 78 hours of and cases of GBV are not usually being reported, or people don't know where to report it because of the stigma that is being attached to it. So when this is not done in the right channel, and what need to be administered to such individual will not be administered, and then it could result into getting being infected with STI or HIV, and which may related to AIDS over time. So those are part of the things that comes with abuse. Then we have the social consequences also. When somebody got raped and they didn't, they, because of the stigma, they kept it to themselves. They might be pregnant and then want to go and have an unsafe abortion. So during that one, it could lead to bleeding and then death. So due to what do you call it, where the abortion is, because the abortion cannot be done in a what do you call it, most times will not be done in in a safe and a good environment. So consequence of it could lead to infections. Even if it's done successfully, it could lead to infection. It could lead to HIV where they did not actually sterilize their instrument. Most of these abortions are done in places where you cannot actually have a safe and hygienic, and by non-professional also. So that is why death can actually occur. Then you have the, like I said, sexually transmitted infection like HIV, pregnancy complication, miscarriage, stillbirth, due to probably when they are doing the abortion and some vital organs are being distorted within the, probably the pelvic or the wombs and things like that. Then premature birth, low birth weight, vaginal bleeding or infection can also resulted as a consequence. Some of this can happen. Probably the woman is being where intimate violence occur. The husband is beating a pregnant woman, or is not feeding the woman well. Maybe the woman will feel is not when you don't have you have a denial of resources. She's not working on herself. The husband is not giving. Only give food for once in a day for like somebody that can with money that can feed just one person for 5 people. The woman will not eat well, and then it could lead to premature birth. It could lead to low birth weight. It can also lead to other things like that. Then during also forced penetration, a chronic infection can occur, long lasting one, when it's not properly treated at the right time, and because of the unreported cases. Then urinary tract infection can occur. Then we talked about fistula the other time. Obstructive fistula can happen. Rectal and vesical vaginal fistula, both of them can happen. We have the rectal vaginal fistula than the vesical vaginal fistula. So the one that happen to do with the urinary bag linking up with the vagina, and then we want that with the anus that linking out with the vagina. So then we have the painful sexual intercourse and sexual dysfunction that can actually occur as a result of abuse, maybe from early age and other things like that. So when that person grew up, you might have like that vaginismus can also occur. A lot of sexual consequences that can actually result as a result of forced abuse. Then we have the mental, psychological consequences. That are the depression. The person can become bipolar as a result of that. Of okay, oh, is it me that this kind of thing happened to? The person become depressed, and then I started acting weird, and before you know it, it could lead to total mental disorder. Then the person might have um, sleeping and eating disorder, stress and anxiety disorder. That is a PTSD that I talked about. Then self-harm and suicide attempt. The person might want to attempt suicide. Then it could also lead to poor self-esteem. So it is a very terrible thing. Those are part of the consequence of GBV. So then you have the behavioral and social consequences. Harmful, the person can become an alcoholic or be using substance because of what has happened to them. The person can actually, because of the first sexual intercourse, it could lead to person to have a multiple sexual partner engaging in a risky behavior because of the first act, and then the person can choose to be abusive partner later in life. So then lower rate of contraceptives and condom use. The person might not want to engage in the use of condom again or contraceptions and things like that. Then rejection from family can also occur. And then family breakdown, social rejection, isolation, stigma, and withdrawal from social community life. So all these are part of consequences of GBV. So and that that on the and then we are going to the final part of our discussion. That is understanding the root cause and contributing factor to GBV and guiding principle. So we identify the root causes, contributing risk factor, understanding and describing the guiding principle of working with survivors of GBV. So we have the root cause as combination of social and political disorder, um, absence of rule of law, corruptions, lack of impartial or functioning judiciary, and fears of perpetrators. So let me start from the fear of perpetrators. Like, let's say, we talked about initially, we talked about power imbalances. So most times, the perpetrators are usually people that are more powerful than the what do you call it, the survivor. So, and because of that, the person might not want to what do you call it, might not want to um, uh, will be subjected to agreeing to whatever the perpetrator wants to do because of probably the high status of that individual or things like that. Then also, when these cases are reported to the police will ask you that, okay, oh, can you what do you call it, do um, we talked about taking evidences, maybe a seminar evidences and things like that, and they thought that they are the first person that's supposed to be. Uh, and most times when cases like this open, nobody will wait and say, okay, we want to come and take evidences. So most times the people that probably some of them have tampered with evidences. Maybe the woman will have the police say they want to take the semen of the individual and do a test and to so as to confirm if the person is actually penetrated or something like that. If there is no physical evidences, then this one, and then the judiciary not giving the right judgment because of the power of the person that is involved, using money, monetary value to buy judgment and things like that. So that's why you see that people just go away with things that they feel they can do things without being punished. Then the corruption in our society also is also part of that. Then it's not that absence of rule of law. The rule of law, yeah, it could be there. Then not abiding by the rule of law that is even existing. We have a constitution, we have this thing, and people not following all these things to the letter. They will just do what they want to do because they have absolute power. They are in control of the law, and the people believe that they are above the law, so they can do and undo, and nothing will happen to them. And like we said, and everything is embedded with corruption, impartial or functioning judiciary, and all these things combined together. Then the combination of both social and political disorders are all contributing factors to causes of GBV in our society. So we also have part of it is where there is conflict, war, like here in the northeast where we have our northwest that we have conflict. People who are in the IDP camps, um, they are already their means of livelihood, the economic is already taken away from them, so they are dependent on whatever little amount of food or anything that they can get. So during this period, they are at the mercy of aid worker, they are at the mercy of the community, they are at the mercy of every other person that can actually give them. So at this period, they are more vulnerable to GBV because of not having the economic. That is where the importance of economic, what do you call it, importance is when, because when you have denial of resources, you don't have access to means of livelihood. So whatever is available, you want to do to get food and table water and food for yourself or for your family. So that's where war and conflict contribute greatly to issue of, and where there is war and conflict, you have high cases of GBV occurring in those locations. If you look at Gaza, you look at northeast here because of the long-term Boko Haram, and then the northwest, the banditry. Also, most of the women that were captured were being raped consistently. Even here and the northwest, also they are being raped, and those are part of the things that causes in conflict. They have power, they have gun. If you don't consent to them, they will shoot you or kill you. So some people, they will, instead of them being died, being killed, they will subject to them. Look at the issue of the Chibok girls. Many of them are being married off up to today. They have like 4 5 families. Some of them are here in the northeast. They are already under them. They have like 2 3 children. Some of them are just being reintegrated into the society here in the northeast. They have the government is taking care of them, but they cannot actually go. A very few of them will have opportunity because they are being stigmatized as Chibok girls, and they have children for this um, Boko Haram people already. So these are the effect of war as a contributing factor. Then we have hunger and poverty, like we said. When there is hunger, people will tend to do a lot of things just to get food to their table. And then people with low economic power will also do anything to just to they will do anything. And then when people are being impoverished, they have power, they can say anything, and then people will be ready to dance to it. Then we have the harmful gender norms also. So then the last we have the guiding principle of what do you call it, GBV. So this is talking about where providing services to GBV survival. So what are the things that need to be ensured that we should do? That is, we have to respect the survivor. We have when providing service for survival of GBV, we have the health, constitutional, legal, etc. So we should also make sure that we respect the survivor wishes and that we provide the highest attainable quality. So we're talking about survivor center approach here. So the survivor's wishes is most paramount. Whatever they choose, they want to prosecute a case, they don't want to prosecute it, you have to respect it. So everything is based on their own final decision. So you don't force the decision on survivor. So those are the part of it. So, and we have the ensure physical safety of the survivor here. So that survivor physical safety, they talked about their family and themselves. That survivor can be frightening, their family can find that, okay, if you do this, we are going to kill your family, we are going to what do you call it, we are going to kill your friends, we are going to kidnap your children and things like that, we will deal with them and things like that. So those are the part of the once a case like that is being detected, they need to ensure the safety of the survivors and then their immediate family at all times, so that probably if they want justice, this can be done without fear or favor. So then we have a guarantee of confidentiality. So survivors will also understand that the whatever they discuss with the GBV, what do you call it, caseworker or counselor, everything will be treated as a confidential issue and will not be discussed with a third party except where necessary. So all information gathered must be secure and protect to just to ensure the except the survivor wants to be known or wants the case to go out, and that is when you have to make it public. So you have to ensure that this things is done in a probably a confidential manner. uh, 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 for example, when a survivor or when they here now say, for example, a court, judiciary, or counseling center, you must first of all obtain survivor written consent and that of the parent or guardian of his, or if the survivor is a child. So then you must respect the wishes of the survivor also, the right and dignity of the survivor when making any decision on most appropriate courses of action to prevent or respond to an incident in sexual gender-based violence. So whatever the survivor wants, we talked about what do you call it? Ensure physical safety of the survivor here, guarantee confidentiality and respect wishes, and then the last one, ensure non-discrimination. So those are part of the survival center approach that we talked about. Every adult or child should be given equal care, support, regardless of race, religion, or nationality, sex, or sexual orientation. So that is what ensuring non-discrimination is talking about. So and then okay, I don't know. SOJ, do we still have time or we
We
should?
still have like
eh,
5 minutes there. We still
You
have
have
like
what?
5 minutes.
What do you say?
5 minutes.
5 minutes.
5 minutes.
Okay.
Then we can
Okay, let
take
me quickly just go through
questions.
this one. Yeah, yeah, we talked about different
We
rules
can
and
take
different goals
questions
helping
for 5 minutes.
survivors access services. So here, what are the objectives? So we just go to, so here we have multi-sectoral approach to respond to GBV. We have the health in sense that when a case of rape occur, you have to go to the NCC point so that the person can seek maybe there is a case of the individual, if there is any physical injury and things like that. So then the safety and security that we said must be provided for the survivor and the immediate family. Then if the survivor wants to seek justice, So there must be a linkage with the police and the what do you call it, and the legal system, whereby the legal unit will be involved in prosecuting the case. And then we have the what do you call it, psychosocial support that has to come in place, where in cases of where the person is have economic imbalance, maybe economic economic imbalance, and then probably a skills acquisition is being provided to the survivor so that they can be independent. There can be in a safe space. We have safe space in different locations, whereby let's say in terms of physical abuse by the husband, the wife can try to live and stay in a safe space where they or in some cases financial aid, like in kind of physical cash, can also be given to a woman to start a business, or to stay on their own, or to move to looking, or to even prosecute a case. In these cases, there are things whereby we have cash being transfer is being done by partners or by organizations to help a survivor of GBV to survive and live a dignified life. So then also, like we said, on the act, we have the act actors, which include the doctor, nurses, midwife, minister of health, and other actors. All of them are involved in a survival. So where they collect medical examinations, document injury, collect evidences, then provide information about possible health consequences and social violence to the individual. Then psychosocial actors include counselors, volunteers, community organizations implementing GBV programs and educational staff or refugee in school. So they provide counseling or group counseling and discuss and encourage coping mechanisms that survivor can then provide material support for survivor, including clothing, food, and they can also provide shelter for the survivor and provide training, skills acquisition for survivor that does not have that one. So we have the safety and security actor, that is the police, the security forces, the refugee security worker, community member. So they take detailed statements from survivor, establish fact, investigate cases of violence, arrest and suspected perpetrators of sexual violence, provide information about legal and judicial remedy to survivor where they want to seek justice. So then the legal actors include the human rights organization, hosts, judges, other officers of the court, legislator, lawmakers, community leader, advocacy, and advocacy group to enhance good policy concerning GBV. So they assist survivor in bringing their case to court, take detailed statement from survivor, establish fact, apply relevant national law regarding sexual violence, decide whether a rape took place or not. So and then rules and goals of everyone responding to GBV. Number one is to consider the safety of survivor, ensure referral to the appropriate services, then treat survivor with dignity and ensure confidentiality and coordinate support with other sectors or other actors in the community. So then uh, the survivor communication skills. At SOJ, do we still have time? Hello? Hello? Hello?
Hello.
Hello,
Let's take
SOJ.
questions. Let's take questions now. Let's take questions.
Okay. Let's just take questions now. Let's just stop here. So we
Yes.
might do this for another day. Yeah.
Yeah.
Thank you.
So I will share the slide. I will share the slide with
Yeah,
the.
and
Okay.
I'm
Yeah.
sure.
Please do share the slide. So
Thank you very much for your brilliant presentation. I learned so much from you. So, do you have anybody with questions? Anybody with questions, please ask a question from your clinical practices or legal practices. It covers something from legal and medical fields. No question, right?
no, people are still looking. Now let them. Let me just go
Okay.
back. Maybe they want to see the slides from the beginning, so they can be
All right.
checking.
Or the definition. If you have any issue of that, you can ask your questions.
So the materials will be shared after
Good evening,
this
sir.
training. Yeah. Good evening, ma.
Okay, somebody is asking now. Who is
I
that
have the
one?
best one.
Okay, ma. I'm listening.
Introduce yourself. Introduce yourself. Introduce yourself.
Is it consequences of gender-based violence that you said honor killing?
Yeah, honor killing. Yes, honor.
Please, can you give me more details about honor killing?
Okay, there are some traditions, there are some ethnic groups that do what do you call it, in a form of honor killing is they just try to probably have we heard about cases whereby women are being subjected to maybe one maybe a female child, maybe they were they can say that okay, we don't want a female child or something like that, and then they decide to molest or kill such a female child in the community. I think that is what the honor killing is all about, and the culture that does this one regularly. The culture that does this one regularly. So SOJ. So I
I
don't
hear
know if
you. No, you are right.
I
You are
give
right. You
you
are right.
appropriate
Also,
response to that.
it's part of it's part of
Mm.
the harmful traditional practices.
Practices,
You are right.
exactly. Uh-huh.
Some people they select male gender when the wife
Mm-hmm.
give birth to a woman. Maybe the man is looking for a male child and they are be having 5 girls. They will say kill that one. You
And then
understand?
there are cases whereby they can even go that like maybe they can say that there are places. Okay, let me use like some of the Arab cases like in Afghanistan and some other places that they can say that maybe or India. Let me give an example. When if India have a lot of rape cases, there you see what do you call it, women are being subjected to rape. At the end of the rape, it is still the woman that the family or the community member will tag as as the people that fought, and then they might try to stone them to death. So that's an example of honor killing, because they said they have brought shame to the family. They are not the one that is actually at fault, but because of the complexity of the society and then the practice of those society, so that is why they will consider them okay. Oh, they rape them, oh, but the family will still want them to be stoned to death. So that's an example of honor killing.
Okay, thank you, sir. What about jewelry abuse?
What do you say?
Jewelry abuse.
Jewelry abuse. Okay, dowry abuse. Okay, abuse of dowry. Yeah, 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 yeah. Abuse of the dowry. That one, yeah, is also a form of what do you call it? Harmful traditional practice that have been done in some culture, whereby uh, what do you call it? They can decide to. Let me see how I can give example of that one. Self, they 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 can say that, okay, the uh, there are things that comes around with that one, but I'm trying to look at the what do you call it, the appropriate examples that can actually um come into this one. But at least I know that usually it's still form of what do you call it, that happens in some society, usually affects individual where what do you call it, is a form of exploitation from some instead of them probably uh, ah, uh, I'm trying to give appropriate examples, but I can't figure that one now. But subsequently, probably that an examples will be given to you. SOJ, can you help out? SOJ, hello, SOJ, hello, hello.
Hello, sir.
Hello. Okay, I wasn't hearing you again at that time, so sorry.
Okay,
So
sir. I
you are
was just
mentioning
thinking that,
dairy abuse, right?
yes, sir.
Okay. And it's still what do you call it? Usually, and I'm just looking at the typical examples that can actually go with that one. But at the moment, I can't think of any on my head. But usually, is a form of abuse that has been perpetrated by families of grooms. What do you call it? And that want to pay what do you call it to the bride family and things like that. So it's a form of violence that comes in. But I'm just trying to look at the community where this happened. But it's also a form of abuse.
Okay, sir. I was thinking maybe what I was having in mind is like maybe adding unnecessary items that are not necessary part of the jewelry, and then requesting it from the suitor to pay as part of the bride price. I don't know if that is also part of the jewelry abuse, a form of abuse.
Yeah, it could
Hello.
actually be. You're actually very correct. You're actually very correct. You are right. It's
Okay.
a form of example that we can give in this situation whereby overestimated, and in this kind of case when it happens, the things that can happen, okay, I've paid a large each sum of money for you, and then I've bought you from your family, and that kind of things that will happen, and then before you know it,
Yeah,
then abuse
I really
will
get the
result.
point, sir.
You are very actually correct. Thank you.
Thank you very much, sir. I really
You're welcome.
understand now.
All right, thank you. So go to the comment box, give any emoji you like to appreciate our presenter. Then I will ask Mrs. Florence to give a vote of thanks on behalf of the class while we start the next session with Ajia Rukayat on intimate partner violence. So, Mrs. Florence, can you give a vote of thanks to thank Mr. Mohammed for spending time? He's a very busy man. I was not expecting him to get the time anyway for creating time, and the content is very robust. I can confess to you that since we started all these batches, this is the best version we have in terms of understanding GBV. And the material will be shared to those who are on the premium WhatsApp group. All right, thank you very much. Mrs. Florence, you can go ahead. Mrs.
Okay. Good,
Florence.
Ah,
good evening, everyone.
You can
good
introduce
evening, ma'am.
yourself, tell us about yourself, where you are joining us from, and your occupation, your location and occupation. All right, go ahead.
Okay, sir. I'm by name Florence Bongaloku. I'm a nurse and I'm from Gombe. We really appreciate you, sir, for the wonderful presentation that you've made this evening, and we are so much grateful for how you've been expatiating the presentation, the slide, and everything. Thank you very much, sir. We are so much grateful for the presentation, and we look forward to hear you once again. Thank
Thank
you
you very
on behalf
much.
of the
Thank
host.
you. Thank you,
All right, thank
everyone.
you very much. We hope to see you next batch, Mr. Mohammed. I hope you are going to have time. All right, thank you
Okay.
very much. Let's go to the next one now. Thank you very much. Okay, bye-bye. All right, so I present to you Ajia Rukayat, who is going to, Ajia, can you go to the page one, the slide of the page one, an introductory part. So Ajia Rukayat, she's a PhD
Okay.
candidate on intimate partner violence. That's her area of specialization. So I must confess to you that everybody has his or her own specialization. Myself, as a GBV specialist, I don't have half of the knowledge she has now because she's a specialist in IPV. That's what she's writing her PhD on. She's completing her PhD at University of Port Harcourt, and she's based in Abuja. So this evening, she's going to give you, how do I call it now? A kind of a panoramic view of intimate partner violence. And Mr. Mohammed also mentioned to you that GBV manifests in different dimensions. And one of them is boyfriend and girlfriend, man and woman. We have seen cases where man kill a man, when man kill his wife, or the wife kill wife kill her husband. Then there was a case in Zimbabwe. I will share to the WhatsApp. She's going to mention that one. I heard from her last batch. A guy killed himself, committed suicide because his girlfriend told him that his manhood was small. That is part of the thing we are talking about. So Aja Rukayat, you have the floor. I'll hand over the class to you now. I'll come back. Please help us manage the time. If you can wrap up by some minutes to 6, so we can take your questions, it will be nice. You don't want to really go back more than 6:10. All right, thank you very much. You are welcome.
Okay. Good evening, everyone. Let me know if you can hear me. My name is Rukaya Oraji. An IPV specialist. So I'll be taking IPV. Let me know if you can hear me so that I can continue. Hello?
Yes, we can hear you. Hello, we can hear you.
Okay. Okay, then good. So IPV, the table of contents, we have the introduction of IPV, type of IPV, prevalence of IPV, cycle of IPV, and risk of IPV, effect of IPV on the victims, our survivors, and the intervention as a IPV specialist. So the prevention, the rules, the medical management, and case report. So I'll go through the introduction. I'm going to be fast so that we go into the case report quickly, because that's what we're going to give you a guide on how to attend to IPV victims or survivors. The intimate partner violence is a pattern of behaviors in an intimate relationship where one partner seeks control or harm the other. It affects individuals across all social, economic, and demographic background, but women are disproportionately affected. As we all know that the entire GBV, women are at the receiving end because of the nature, I will call it the nature, the custom, the tradition, and the financially dependent women usually be. So IPV can come in form of physical, emotional, psychological, sexual, economic, or digital from past or current partner. It might be marriage. It could be, boyfriend, girlfriend. It's just about people in romantic relationship. So the physical IPV now, example of it is hitting, slapping, punching, using weapon to threaten the partner. You see girlfriend and boyfriend, there will be slaps, and all. Wow, the NEPA has taken light here. So we have sexual IPV, which is like coercion, forcing partner. But in Nigeria, when you go and say that your partner rape you, your husband rape you, people will actually just see it as not interesting. But it does happen because sometimes you might not be in the mood and your partner force you or do stuff like that. Then we have the emotional and psychological abuse of IPV, which is the most difficult and common one. The person use fear, threats, manipulation, controls you, criticize you, your looks, you are not beautiful, you are fat, you tell the man that, his PP is small, he can't last in bed. Those are the psychological aspect of IPV, which can actually affect the mental health seriously. And we have the neglect. The neglect is the inability to meet the partner needs, the basic needs, like hospital, economic abuse. Example of neglect recently, there was a circulating news on media where the guy was not able to take the wife to the hospital, a pregnant wife, and the woman died while transporting her from one place to the another. Those are basic necessities that he's supposed to register her in a government hospital, let her have a card in a hospital so that when labor comes in, you'll be able to take her there. But in these there are cases, nothing was done. So the woman died. Then we have economic abuse. Economic abuse now is not having access to money. You see men, so it's usually happen now in the cases of a man, though it can also happen when a woman is controlling the financial of the man, but most importantly, most commonly is for men. You see a woman, even though she's working, I have a case where this client, she's working, but the husband is with her ATM card. he receives her salary and spend it the way he wants it. That's an economic abuse. Then we have a digital abuse, monitoring message, email. You see here now, we have different kind of abuse here. Here now is like, this is a sexual abuse, IPV. They should be husband and wife. This is a digital IPV, and this is an emotional IPV. So there are different kind of IPV that is here. You can see now, you see here now, in this case now, the woman is the abuser, where the husband is the victim. So in this case now, this could be like an emotional abuse or sexual abuse. Different kind of IPV can give rise to another. Most time, the digital IPV can give rise to physical. Why are you searching my phone? The next time, pam, this person has slapped the other. So those are common things. And IPV is pandemic now, is a common occurrence every day. Prevalence of IPV, that's who does it affect more? According to WHO, said 1 in 3 women worldwide has experienced IPV in their lifetime, either with their current or past relationship. And you agree with me that you and I here now, we might have experienced IPV either in our present relationship or past relationship. Sometimes you think about it like, oh, my ex-boyfriend, this is how he used to do to me. You now look at it, that was an IPV. Then IPV also affects men, but mostly is women that are at the receiving end. Then children who witnesses IPV can experience emotional trauma, developmental issue, and may be at risk of becoming a victim or perpetrator in the future. This is how it affects the brain of children. Children who, was raised in an environment where there is always crisis between husband and wife, the brain grows to tell them that is normal. They see it as normal. I've had a client before that he usually hit his wife because he grew up in the village with his grandfather, whereby the grandfather always, he beat the women, his wives, like a child. So he doesn't know that women are not supposed to be beaten. So when he moved to the city and he got married, he started hitting his wife until he undergo some therapy, and he was able to realize that is not right. So a lot of people who are perpetrators, like they are the abusers, they learn it from people. And the funny thing about this IPV or any of the abuse is it tricks the brain. So when a child witnesses the parent always fighting, but the best thing the mother is always doing is to find therapy in the child. Mothers will call their children and say that, Matthew, see, don't be like your father. Your father is a drunkard, is a womanizer. Don't be like him. He used to hit me. Don't be like him. But the irony is there that this child is going to grow up hitting his wife. That's how funny IPV can be. This child that witnesses it and know that it's very bad is going to grow up and do the same thing because the brain has developed a coping mechanism, noting that this thing is normal. So whenever the wife shouts at him or somebody screams, it sounds as violence to the brain, like a PTSD, post-traumatic stress syndrome disorder. So now the cycle of IPV. IPV is a cycle and is like an addiction pathway in the brain. So it's something that the abusee, everybody will advise him or her that this is leave this relationship or end this marriage, but it's not going to happen because it's occur in a cycle and it's a repetitive cycle. The first is the tension stage, where like you see here now that in last month, this lady was murdered by her husband, and they dated for many years. So someone should read it for me if you can see it clearly. Hello?
Hello? Can you hear me? Hello? Can you hear me?
Yeah. Yes, I can. Go on.
Okay.
Go on.
Success friend.
Yeah.
Success friend. Hello?
Yes,
Success
yes.
friend
Success friends.
were also talk to our reporter, say most of their friends,
Yes.
including herself, want Success not to marry Kelvin because of his violent character, and them also don't they advise her to quit the marriage after them notice say the domestic violence come increase after their marriage, but Success refused to listen to their advice. Copied worry
Good.
apropos
Good.
too.
So yes, good. So this is Success now. She was dating this guy for a long time, but there's always a violence. The guy beats her. He has an anger issue, but she loves the guy. So the friends said they keep warning her, advising her to leave the relationship. She refused until it ends in marriage, and he end up killing her. So this is where I'm going. So now, this is where I'm going. So now, you see now that the event, why is it not scrolling? Okay, coming. No, I want to go back. Good. The circle now, the tension building phase. This is how it started. It can start with your husband, your boyfriend, your girlfriend. You start complaining about something, or you started checking your phone. Let's use the digital abuse as an example. You started checking your phone and said, who are you chatting with? I don't want you to have contact of any male contact. I don't want you to put status on your DP. I don't want you to do a lot of things. So in that scenario, you actually to maintain peace. So you said, okay, I'll stop wearing trousers. I'll delete all my male friends on Facebook and everywhere. In fact, I'll stop using social media for now. Then you just lay low. Then there will be a time he'll come home and meet you with your phone again. And this time around, he slapped you. That I asked you not to have a male friend again, or who are you talking to? I checked your message. That's the incidence of abuse. This is the step 2. Then the third stage, the reconciliation stage. In that stage, when he slapped you, you can run to your parent house. The victim might actually seek advice from somewhere and they talk to him, or you might not even seek advice from the third party, but later you just come back in the night. And if it is a marriage, sex is usually the easy thing to reconcile couples. They have an intimate time and everybody is happy. I'm sorry, you can buy her a new wig, a new shoe, a new phone, something to make her happy. So the person is now saying, oh, he has changed. That the people that advised her before to leave will even be wondering. He said, no, he has changed. So there's going to be a calm phase now, which is the last stage now. There's going to be a calm phase. There's no problem again. That's the honeymoon period. Is now good. He even allow me to wear trousers. He allow me to go out and see friends. But the funny thing is that this is an IPV. It's going to come back again. After some time, it will come back again. So that's the scenario that happened here. And the frequency of the relapsing, the dangerous it is. If he slapped you once in the first episode, when next, it might take 2 years before it repeats itself. It's going to slap you, like it's going to punch you and beat you. And before you know it, the calm phase will come. But this time around, it will not take up to 6 months. Then the incidents will happen again. So it will keep coming, going repetitively. And the abuser will be confused because this is something that is someone you love, an intimate partner, someone you love. It's like a sweet and bitter, stuff. It's like sweet and bitter. This is the person I love. He hits me. The next minute he said, oh, I'm sorry. I was just angry. Today, a client reached out to me and said that she's living her 4 years marriage, that the guy is always beating her when he's angry. He pour hot tea. He just make a tea cup for him. He just pour it on her face. Then sometimes he'll strangle her when he's angry. He wants something to punch, that he has anger issue. So she said she's leaving. So, but most people, you are leaving, how to get a safe place, how to leave that relationship. So we're going into that. There's now risk factors of IPV, this intimate partner violence, who are at risk, who can, what can make it to happen mostly, like the triggers. We have gender and social norm, especially in Africa, in even every other countries. In the US, so many reports of intimate partner violence, deaths. You see men shoot his wife and children, mass shooting. Different thing is the pandemic and nobody is talking about it. So the gender now is because we are women. Women are said you should be submissive, and the submission that they are talking about in every part of the world is for you to be stupid. Yes, you should be stupid. You should not have a voice. An Indian lady reported last year, the husband doesn't want her to be financially independent. So she is so brilliant and she loves to proceed in her career. So when she went to apply into a university for her master's, her husband was happy for her, not knowing that he is not happy. So the day she got her admission letter, she was sleeping and she wake up to come and meet that all her right fingers has been butchered away. That is a violence because he doesn't want her to go to school and write. He doesn't want her to become anything. So he intentionally do that just to stop the progress of the woman. I've had clients also that the husband in Kaduna, the husband lost his job. So this woman virtually pay all the bills of the house. She's a teacher, but this man started saying that she has to resign again. They have to be the same. To the extent that this woman I have to advise her to send her documents to go and keep in a safe place because the man wanted to flush. He flushed all the documents, not knowing that they are photocopies actually. He flushed them into the toilet so that the woman will lose her job and become nothing. He started beating the woman, started being bad. And social norms that in some areas, women marry at tender age, 15 years in the north, precisely, married like a 60-year-old man. That's a violence. So the previous exposure to violence, just like I said in the case of children, any child that grew up in an area like a very rowdy area, people beat their wife, people touch. You see a guy in some areas now, like in a very polluted area, a young girl can be passing and some area boys will tap her on the ass. That's a violence, that's a sexual harassment, same as when some men, beat their wife in the house, even in the presence of their children, shout at them. When the man come, everybody run away. Those kind of violence we stable on the child's brain, and when he become matured and got married, he's going to, exhibit the trait. Then substance use, some women said their husband gets angry, beat them when they take drug. The triggers are they take drug, they smoke, or stress when they're tired from work and you talk to him, he slap you. So those things are triggers. Then economic stress. In Nigeria currently, most of the risk factors and triggers of IPV is the economic stress. Your husband gave you, the man will go and bring out like 5,000 naira to make soup for 1 week. And this is impossible. So the woman like, Baba Fatai, this money is too small. We cannot even make a goosey from it. They'll start raising themselves. They'll start insulting themselves. This one will say that will pack your things and go to your father's house. Before you know it, they'll start hitting themselves and stuff. Then we have the mental health issue. The mental health issue means that the brain is already stressed, either from different sickness, disease condition, or life, life stress. So the mental health is already down. There's no joy. The serotonin level is so low. Nothing is working. Then you talk to that person. You even see such women, they don't even have, they are not aroused sexually. They are not in the mood. And someone that there's no, the happy hormone, the serotonin, the vasopressin, everything is actually down. And the man wants to initiate sex. Before you know it, there'll be violence. So the effects of IPV on the victim now, we have the physical consequences, which is maybe the beating, the scars, lost some bones and stuff. Some lost their sight, some lost, like that woman that lost her fingers. Those are the physical consequences. And we have the emotional and psychological consequences, which is the most important one. you see some people now, they've actually, developed a coping mechanism to live with that abuser. Because number one, in Africa, mostly when you get married, everybody has said bye-bye to you. Yes, when I newly got married, there was a time I had issue with my husband. I was so angry. I said, I want to go to court. 90% of everybody will advise you that don't leave your husband, because they don't even have a preparation plan. There's no plan B for you when you leave your husband. Family are not ready to take their children back. It's like they sold you out, But it's just, those are the emotional and psychological effect. So before you leave now, some people will now say, where am I going? I have to stay with my children, because even if I want to go to court, I don't even have money to pay lawyers. In fact, I can't even feed myself without my husband. And is something they use a style. When your abuser will make you financial dependent. Because when you become financial dependent, imagine if your husband is the one giving you everything A to Z. Even if you want the sex like 5 times a day, sometimes you're going to say, okay, because there's so many things you're going to be accepting, because you cannot really live without the person. Same thing they do to young girls, when they make them sex slave. Why they are doing them is that they know they've already put those girls, they'll buy them an iPhone, they'll buy them a car, a Lamborghini or something lower. But these girls, they don't have an income to maintain this lifestyle. So they are going to be in that gender-based violence, keep staying with their abuser, because they want to maintain the lifestyle. So we have economic consequences. A woman will leave that marriage now because she doesn't have a job. She didn't go to school. She will not be able to even take care of her life again. Or some people, during the violence, they burn the properties of the partner, they render that person, very, very financial reckless, like social consequences, the stigma. So people are still in their abusive relationship now because, how will I say that I've divorced? How will I go to church? How will I go to the mosque? How will the society see me? The stigma and stuff. Then the intervention and prevention of IPV, the primary prevention, which is what we all know we are doing now, education, giving you the knowledge about IPV, the awareness, how to go into it. When people like you are telling people that are not involved in IPV on how to help. That's when we have the 3D to distract them. The first D, you tell those neighbors, you already hear now that this family, there's an intimate partner violence among the husband and wife. So the neighbors, when you hear something, do something. That's the 3D is distract. You distract first. When you said, who is there? Are you okay? How are you? Are you okay? You see, even if a man is on full erection trying to penetrate a woman, by the time you just heard something, it's like a reflex action, like, hello, are you okay? That man is going to, the erection will go down immediately. So it's a way of saving that person, and also, to when you have just distraction, like to deviate the person's whenever you see some people arguing so badly, you can actually bring a news, something to make them happy or something funny in a way that it will just distract it to happen. So you have to tell, that's a bystander intervention. Like those people, they are not actually involved, but they are taught on how to involve whenever there is a problem like this and how to report. You can report anonymously, like, number this, there's something ongoing there. We report with a faceless ID on Facebook or anywhere. Then we have supportive communities. Supportive communities now is when people like us, we the specialists, you have the advocates, the advocates, there's some NGOs, some group of people who've now like, okay, we're talking about IPV now. So if you have anything, we have 24 hours free call number, call us. You can call us anonymously. This is how to intervene on those victims, the survivors, how to help them start their life again, to have a safe place to go, and how to help them report. That's the legal reform and advocacy. Then that's what we more under primary prevention is the awareness. Secondary prevention is the healthcare now. How to discover, to identify this your client is going through IPV. some patients keep coming. One is on the frequency. You have a particular client that is always coming on the emergencies with bruises, you know, with multiple wounds and sad face. Sometimes they come with the husband. Mostly they'll come with the abuser. So you see that whenever you try to make privacy and ask these patients a question, is the husband that is answering for her. You might have come across some of those patients. If you are a nurse, you saw like, madam, what happened? The husband will say, she fell. Okay, how long did you fall? Just now. You know that this person is actually abusing that person. So it's controlling the person. So we have tertiary prevention. That's the legal reform, going to forensic, which you must take permission from the person first. Then the treatment and support of IPV for victims, counseling, safety plan, shelter, legal aid. The most important thing about IPV is safety. Yes, this is what I'm feeling. It's a sweet and bitter scenario. This person that is my enemy now, that is beating me, is also my love, is also my sweetheart, is the sole provider of me. So what do I do? If I live here, where do I go? So firstly, you cancel the plan, how she should identify or he should identify the types of IPV is going through, and safety planning. Do you want to exist? Some people plan to japa. Yes, I want to run away with my children. I want to migrate, you know, and legal aid, how to get legal aid. And, you know, some lawyers, they do pro bonos. If they are working with some NGOs that their objective is on IPV, so there'll be pro bono, someone to help them for free or for little payment. Then for perpetrators, we have the Batara intervention program. This is very, very important that most people really don't take necessary. Is, okay, those people that are battering, if we keep helping the survivors, the victims to run away, to go to a safe place, to exit the marriage, but those batterer, those perpetrators, how did they know that what they are doing is wrong? I have told you an example about a client that he grew up saying his grandfather always beat the wives, treat them like a child, beat them like a child, and you know. So now he grew up beating his wife. His wife ran to me. I was able to, you know, cancel both of them separately and make the man knows that what he's doing is bad. And, you know, there's always way to relearn and unlearn. So he unlearned what he has on his brain before and relearn how to take care of a woman. So in some cases, the intervention we've done is that we realize that the triggers of this IPV is because the man is jobless. They are jobless. They are always angry with their wife, beat their wife. They demand for sex like 7 times a day, you know, stuff like that. So you empower, you try to empower. Some NGOs empower skill acquisition. If this person learn bricklaying, learn carpentry, how can you, you know, give them skill, give them equipment to keep them busy? Then you now follow up. This follow-up is what will make you to completely have a research. This research is where you go for, you look at follow-up on what has happened before and how are those survivors coping till now. You know, it's a different ball game to identify survivors, and it's another game to, you know, follow up to know their life in the future. Then the healthcare, legal, and service. There's what the WHO is trying to call one service. Is it one health kind of? I don't know how they put it. Whereby this IPV, the healthcare people will come with the legal and the social service collaboration in one office, so that if there is an IPV report, they were able to benefit from all these services at the same time. Then screening and identification. There are different screening tools to identify the types of IPV this client is going through. And the first thing is to identify, then you know how to advise. We have the hit, hot, insult. This is like a questionnaire. In this hit is how often does he hit you? You know, how often does he insult you? And how often, what is the third stuff, right? The hits. Then how often does he threaten you? That is the T. So when you are able to know, it's like a quantitative approach. You are trying to know the quantity, how often, or those ones, to know if it's physical or is emotional. Then we have the worst woman abuse. This worst is women abuse screening tool. So it comes with the kind of question to ask. Has he ever kissed you when you are not in the mood? Has he ever slapped you? Those one you are looking for quality. Then we have the radar. The radar now is remember to ask. Ask directly. As you are asking the patient, the client, you are documenting it directly as she says it. You are going to ask directly and document and assess safety. The R for remember to ask, A for ask directly, D for documents, A for assess safety, and R for review your options. So because most times your clients, when she's being battered and calm, you give her a safe space. You're going to give her, put yourself in her shoes. You're not going to sympathize with the person. You sympathize with accident victims. But for IPV victims and survival, you empathize. Empathize means I am putting myself now that I am Memuna. The first name here I saw now is Memuna. So I'm actually trying to be a Memuna, just like you're acting a movie. So your emotions will be up. That's when she will trust you to tell you. You can keep asking a patient that what happened. He'll tell you she hit her head because she's a coping mechanism. She doesn't want to, indulge the man into a problem. There's a scenario that happened last month where a man is always raping his 9-year-old child, a girl. So he raped this girl often every time until this girl has VVF, the vagina is destroyed, the muscles are destroyed, and the anus. So when he was arrested, do you know what the wife said? The wife started pleading with the judge not to send the husband to the prison because this time now is my husband who will take care of me, who will take care of the rest kid. I forgive him. So I forgive him. So you see, in this scenario now, the victim has developed a coping mechanism to live with her abuser without any complaint. So warning signs to see from your client to expect when a client keeps visiting with different wounds. The wounds are usually, evasive behavior, the partner is controlling. Then the wounds are usually on the neck, on the back. You should be on the face. You should query IPV and try to create a very, safe place, quiet place. It should be when you're cleaning the wound, you just trip in and ask her that, did he actually hit you? She can start talking. Sometimes you can even exaggerate your own feelings and say, yes, when my husband used to hit me or when my neighbor's husband used to hit her, this is how she usually feels. Then it will trigger her to talk to you. So you need to create that trust between you and the client before you can help. And every help has to have, you have to take permission from her because some clients that comes and talk to you, by the time you report, she can deny you because this abuser is also her loved one. So she'll just deny and said, no, he doesn't used to beat me. She used to take care of me. So whenever you are document directly and make sure you have, you take pictures, just have something concrete as an evidence, treat physical injuries, address sexual assault, rape kids, mental health crisis, refer to the psychiatric counselor, and also document to be used for legal proceeding. And any legal proceeding has to be consented. When the victim, the survivor said, no, I don't want legal. Just do your job and don't go to legal. So now a patient age 29-year-old female comes to the ER 3 times in 2 months with accidental falls. This is a query now. This is something this is a red flag that this should be an intimate partner violence. The findings is bruises on the arms, ribs, back, fearful, is sad, is fearful, is having anxiety. He doesn't want to look at your eye. And even if you come with the partner, she's just sat, not in the mood. The partner may try to be holding her and she'll be removing her hand. So these are signs that there is evidence of intimate partner violence. Then the intervention now is private screening. She can disclose her partner hits her, safety plan. It might actually be a male. Like those pictures now, those are the kind of what you should look at. Then another case report now. In this case now, the man is the victim. The first one is form of physical violence or sexual violence, but this second case is emotional. The male is having a 35-year-old male visit primary care for insomnia, anxiety, emotional abuse by a wife, belittling, financial control. Some wives can really, really belittle their husband. You'll be shouting at him. You cannot last on bed. You cannot provide for different things I want to buy. You know, this thing can get to the brain of the men, and men hardly talk. Men don't cry, as the African says. You know, they'll keep holding it on their brain. This one now, he killed himself because his girlfriend mocked him for having a small pimping. You say he cannot bear it. So when those kind of cases come, you should know how to address it. In this kind of guy now, you're going to put yourself in his position. You can even exaggerate it and say, oh, your friend has this kind of this, but he should know that he's okay. He's okay, he's good, nothing is wrong with him. Speak some positivity into him and let him know that there are other girls that will value him. There are other girls that their specs are just the same, the way he is. So this thing can really help him, but he has no one to talk to, so he committed suicide.
Can we go to the conclusion? Yes. So we can take question. We can take question for the last 5 minutes.
Yes, that's the conclusion now. The intimate partner violence is a public health, so you can send your question, ask your questions, then I'll look into it. I'll attend to you now, or I'll send it to the WhatsApp group because of time.
All right, thank you very much for your brilliant presentation. Thank you. So let's go to the emoji comment box and appreciate her with our best emoji. I'm going to invite I'm struggling. Akinola Ademiho. Let me use Ademiho. Ipo Ademiho to give a vote of thanks. I'm still coming up to that anyway. But before vote of thanks, let's ask questions about IPV now. Questions, real life question. As I said before, this is an experiential learning, which means that she has given example of a lady whose husband abused a girl, and the wife was saying that, please don't take my husband to prison because he's the provider. That's the kind of thing we are seeing in Nigeria. So let's take questions. We have floor for 2 questions before Ademiho will give a vote of thanks. Let's take questions now. All right, any question or contribution you want to add to that? Then the slide for the presentation, it has been shared on the premium group. So this training is free for everybody. However, for those who need certification, you have to pay a token to be in that group. I will share information about that one on the WhatsApp group after this class. All right, thank you. So do you have questions? Hello? Nobody is appreciating that. I see only one. Okay, thank you very much, Ademiho. Go to the comment box, appreciate her with your best emoji. You want to give her a clap emoji, any emoji you want to appreciate her with, drop it in the comment box now. All right, let's take questions. Do you have any question? Do you have any question? Oh, I'm waiting for that. All right, since there is no question now, Ademiho, I'll invite you now to give a vote of thanks to Aja Rukayat. I told you she's an IPV specialist, and each time she comes on board, I learned so much from her. And again, I need to tell you that she was part of batch 9, right? Aja Rukayat, batch 10. So sometimes one of our trainers, they pass through this training, you know. You can't pull from empty kettle, and she approached this training and all that. So basically, we don't claim that we know everything because we cannot teach it all because we don't know everything. So we want to learn from it. That's why we encourage participation, questions and answers, and people can have interactions. So at this point in time, it's 2 minutes past 6. So we respect time. So Ademiho, you can go ahead, please. Introduce yourself, tell us about your occupation and your location, and you can give a vote of thanks. Thank you very much. You can go ahead.
Okay, thank you very much, sir, for the opportunity. My name is Ikwadimi Akinola, and I'm an aspirant of the Nigerian bar, and I'm speaking right from Odomosho, Oyo State. And to our seasoned speaker, I want to say a very big thank you. The intimate partner violence session was very insightful and eye-opening. I've been able to glean more than two things. I've been able to learn a lot of things. Thank you very much, Ma, and thank you for your continued um, support to lending your voice to call gender-based violence. Thank you so much. Thank you.
All right,
All
thank
right,
you, Ma.
thank you so much.
Okay, they thank you in
Yeah.
the comment. Thank you so much for beautiful session, Ma. Which other ones?
All right.
Okay, guys, I didn't know again. It's such an insightful session. Thank you, Ma. God bless you, Ma. All right, thank you. Thank you for this appreciation. All right, ladies and gentlemen, we have come to the end of day one. So at this point in time, you go to the WhatsApp group, you go and do your daily continuous assessment to assess what you have learned today. Those who join self-paced, who will watch the video, and those of you who are in live class, you are going to complete that. That's actually stand as your own what's it called again? Attendance sheet is a record. By the time you graduate from this training, maybe you want to transfer your credits to universities overseas, and they request for your transcript. These are the things you are going to present to them. All right, ensure that you complete your pre-tests, and today's day one DCA. I'm sharing that one right now. All right, thank you very much, everyone. We've come to the end of this. Let me stop recording. Then I'll share the recording to the WhatsApp group.